I'm Dr. Amy Sitapati. I'm a primary care provider and chief of our Division of Biomedical Informatics, as well as chair of our hospital Department of Biomedical Informatics. I'm a clinical professor in the Department of Medicine, and I'm super excited to tell you more about our biomedical informatics programs. The Division of Biomedical Informatics has been present now since 2009, and the momentum is just so exciting. We now have more than 1,000 published papers, and what you can see in that great swath is all of the awesome stuff happening with our faculty. So we span many different components of biomedical informatics, all the things from bioinformatics to thinking about GWAS and FWAS, to thinking through, what about new kinds of methods like blockchain and artificial intelligence? But we don't stop there. We really think about the translational and applied pieces. We think about how to get that closer to the patient. And we think about things like that. We think about, wow, now we have cloud computing and there's an alert happening at the bedside. We think about clinical decision support and many other items. And so what's really exciting about the Division of Biomedical Informatics, not only are we cutting edge and best in class, but we're also pushing the envelope about what we can bring real time to patients to help them today. And so we are definitely someone following what the National Library of Medicine has called data-powered health. Come join us in this great journey of discovery, and we too, together, can bring data-powered health to the world. Now, on a personal level, I really love little data. So all of you know about big data, but nobody's talking about the little data. I'm an expert in little data. So come join me and learn more about registries. Registries refine all that little data. What about the blood pressure medicine? What was your last BP? How do we help advance the care of people living with hypertension? Really common across the US. And you can see today I'm all digital up, but guess what? That's not all. Our patients have digital too. We really work to advance healthcare and digital cuffs for all of our hypertensive patients. And what's super great is behind the registry and the digital cuff, there's a care manager, a nurse, a pharmacist trying to find the patient that's out of control and decide who do they give a call, who needs a little bit more blood pressure, who needs a little bit more advisement in their care. They make those phone calls, they improve the care, and the result of that is we're actually best across the UC campuses in our blood pressure control. Now, my personal expertise coming back to data-powered health is all in that little data. And I can tell you, if you work with me, a lot more you can learn about registries, metrics, and all those good little data grooming. But we also want to have the quality analytics really help drive equity. And I'm a passionate believer in JEDI principles and also having health equity analytics. And you can learn more about that. People come to us across the country. They ask, how did you help to drive so much equity? How do you get the data in? How do you slice the data? And so these really help us think and transform about all the data that we're looking at and being inclusive, not just of the typical demographics, but social determinants and structural barriers that are related to census blocks and other things as well. So you can learn about all this good little data. You can also learn about all of us, the NIH Precision Medicine Program, and it's really phenomenal. I'm so excited to be the site PI at UC San Diego advancing this effort. This is a great opportunity for participants to also be active in the journey of discovery, and they can also get into the researcher workbench and learn how to discover more things to help advance care. We're also really thrilled to help advance our state health through the registries at the state of California. That's called the California Integrated Vital Systems Records, and the CalIVers is really fantastic. This registry helps to advance both birth and decedent registry, and you can learn more about that. So join me today in the discovery of good little data and all the fun that's ahead. You can help to design registries, artificial intelligence, risk scores, and care management, and much more in our division. Come join the heart and be part of data-powered health. You can come join us in data-powered health. Come join us today and be part of our team.